morning. My name is Patience Ndikom. I'm the Chief Administrative Officer at Ideal Home Health Services located in Durham, North Carolina. I chose home care because having worked in different arenas of this healthcare industry, I noticed that a lot of people prefer to be at home. I worked in the hospitals, I worked at UNC, Chapel Hill, I worked at Duke. I even worked in the nursing home industry also. And I noticed that a lot of individuals, whether I use individuals because it's not only the elderly that are at home, whether they're disabled for whatever reason or they're elderly. And when they get discharged from the hospital and they get mended and feeling better, you notice the discharge planners trying to find a placement for them, continuity of care in the community, and most of them don't prefer to be in a facility, whether it's non-skilled facility or skilled nursing facility. They prefer to be at home if they can help it. And so that prompted my interest, kindled my interest into providing, setting up a home care agency, and that's where we are. You have to have the heart for people. You have to be compassionate. That compassion leads you into providing what I call in home health holistic care, because you're encompassing that person and relating thoroughly and truly with the family, because you're in the home every day. You're looking at this family. You see a loved one, but they cannot provide all that the mom needs because life happens. She has to take care of her children. She has to go to work. She's pulled here and there, but she still wants to be that daughter for her mom, and she cannot. So you, as the in-home caregiver, the nurse, the administrator, the in-home aide, you're looking through making sure that she's okay. You're looking through making sure that she eats. You're looking through making sure that her environment is clean. You become a one-stop shop. Whereas in the hospital, you have the doctors, you have the nurses, you have housekeeping, you have dietary. Now you, the person, the home care in the home, you are all it. And so you think about it, you ask yourself, what quality would you have to be able to do all this for one person? You are running a risk because some of these families live in an environment that sometimes you will not want to go to. You take this care to them there because that's where they are. So you have to be compassionate. You have to care about people. You have to have the heart. When you think about it, then you know that it's not really about money. Money is good, it helps, but most of us in this industry knows it's about the compassion. You know, there are days you wake up in the morning and you think about all that you have to do for your own family. And then you think about all the rules and regulations that you have to abide by. You want to say, okay, hang this, I'm not going to go through all this. But when you think about that one person, that one client, I'll give you an example. One day I was having a very rough day. I had a client that time. She was 101 years old, but she was so smart. She still has all her faculties. And I got a phone call from her. So in my mind, I was like, okay, what is it now? What is your aide not there? So when I answered, I said, how are you doing? Is your aide there? And she said, I'm not having any problems. I'm not calling about any complaints. I just want to tell you I'm thinking about you. And so when you remember that in everything that you're doing in this industry, there is one person that you are touching their lives, that you are making a change in them, and they can wake up 101-year-old client calling me for no reason, just saying that she wants me to know she's thinking about me. Then that wakes me up in the morning and that encourages me to go because I'm making a change. There is a difference. The aides are making a difference in a client's home under my leadership.